You would not expect an orthopaedic surgeon to attempt an orthopaedic procedure without taking x-rays, and it's kind of the same for dentistry. You need that information from a dental radiograph before you embark or before the vet embarks on any extraction procedures. It certainly doesn't have to be cost prohibitive. The practice works out its own charging structure, but my recommendation is not to outprice it. Don't make it so expensive that nobody ever takes any x-rays. It needs to be at a price point where you're doing it for nearly every patient. So the average cost will be somewhere between sort of 10, 15, maybe £20 per x-ray, or maybe £50, £75 for a full mouth series. But it allows you to do a lot of different things. It allows you to, well, it allows the vet to make a diagnosis for a start, to choose the correct treatment. We can then monitor disease progression, and it's also very important, I think, for clients to actually see what's going on in their pet's mouth. So this cat was referred to me for this non-healing extraction site. This is just to orientate you, this is the lower jaw, these are the lower canines, this is the left premolar 3 there. That had been extracted because it was loose, it was mobile, but the vet didn't have access to radiography, and it then was referred to me for this non-healing extraction site. So the first thing I did, this is the x-ray machine here, get an x-ray of that, and this is the radiograph. Would anyone like to talk me through what they can see or not see? Its lower jaw is not there, is it? The jawbone kind of stops here. There's a big gap here of kind of tissue paper-like consistency. This root of the canine is very spiky and starting to be reabsorbed. The most likely diagnosis here, unfortunately, for that cat is some kind of malignant tumour, some kind of cancer. So if the referring vet had been able to take this at the time, the conversation with the client would have been very different at that point. And you can see why the tooth was mobile. There's no bone to hold it in the jaw. So it really does enhance the client's appreciation for what's going on in their pet's mouth. And I would urge you, if you can, when you're discharging, I don't know if you do your discharges or the vet does the discharge, but if you can show the client the x-rays when you're discharging them, they understand why the vet had to take 10 teeth out or 20 teeth out, rather than you handing the pet back and saying, well, we took 10 teeth out, that's £500, please. If you can say, well, look, we had to take 10 teeth out, but this is the reason why. This one has got an abscess around the root, this one you can see there's bone loss here. The client understands it much more if you can show them. I think clients generally are quite visual. They like seeing photos, they like seeing radiographs, and they're not thick, they are quite intelligent, so they do understand things when we explain it to them. So they get a better sense of value for money, and it really is the gold standard for patient care for the 21st century. Even on one radiograph of this dog, there are so many things that I can talk about to this client. I can show them all this bone loss around all these roots, bone loss of the jaw here, we've got resorption here, we've got an abscess here. So when a client sees something like that, particularly if I show them what a normal x-ray looks like, they're suddenly in a state of shock and horror because they just didn't realise how bad it had got. So lots of different things we can talk about when we're showing them these x-rays. So really everybody wins. The patient benefits because we're able to detect the full extent of the disease in their mouth. We can then choose the appropriate treatment. So for instance, in cats, you know they get a lot of resorption. You know if anything's going to make your vet swear, it's feline dentistry, isn't it? And you can hear that click and I know what all of you are going, oh no. So if the vet can make a diagnosis on cats with tooth resorption, it may be that they can do a crown amputation, which is where we just remove the crown of the tooth and stitch the gum. Much better than trying to dig around in the bone and look for a root that's no longer there. So as I mentioned, the client actually feels that they're getting better value for money. The practice can also make a profit from taking dental radiographs, and profit is not a bad word. The practice needs to be profitable so that you can invest in new equipment, so that you can come on courses. So adding to the practice's profitability is a good thing. And at the end of the day, you guys can go home and feel like you've done the best for your patients. And the reason we need dental radiographs is that this kind of x-ray, well, what does this tell us about this cat? Oh, I've given you one of the answers. It's a cat. This is a cat that has teeth. That's all I can tell you from that. It really is not helpful for dentistry because there's so much superimposition of one side against the other that we just can't make a diagnosis. But also, we can look at these teeth here with this cat and we can say, well, this one's obviously not healthy. We can see that from the crown. What we can't see is the root structure. We can't see the bones surrounding the roots, so it's very difficult to make a full diagnosis. And also this tooth, okay, there's some calculus on it, some tartar, but the gingiva doesn't look particularly inflamed, there's no draining sinus or anything. We really don't know if that's healthy or not. Once we get the x-ray though, we can see that both teeth are diseased, and we can also see that this distal root of this molar has almost completely been resorbed. What we're looking for is signs of our periodontal ligament, which is the ligament that holds the tooth in the socket. We should be able to see that as a radiolucent black line surrounding the root, but we can't make that out here. We also can't see signs of the periodontal ligament on this tooth either. So these teeth are undergoing what we call type 2 resorption, which is where the tooth root is resorbed by the body, a bit like a Pac-Man going along and eating up the tooth substance, but then it gets replaced by bone. So this is effectively bone now, that's bone and that's bone. So what would happen if your vet starts to try and extract this tooth? You will get that familiar cracking sound, you will then maybe get a muttered swear word underneath the vet's breath, hoping that you didn't hear the cracking sound. This is going to break. You're not going to be able to extract that tooth root because it's not there anymore. Similarly, that isn't tooth root anymore, it's now being converted to bone. So the appropriate treatment for this cat is to fully extract this root, but then crown amputate there and crown amputate there.